You are listening to the Summit FM, and I'm Chad Miller here on the phone with Dr. Tom Jiao, hand and wrist surgeon at Crystal Clinic Orthopedic Center and a specialist in surgery of the hand, wrist, and arm. He sees patients in Farallon, Barberton, and Warren. Dr. Tom Jiao, how are you? Good to talk to you here today.
I'm great today. How are you doing?
I'm doing all right. You are a graduate of the University of Tennessee College of Medicine, served a residency at LSU's Department of Plastic Surgery, and completed a hand surgery fellowship at Kleiner Cutts Hand Care Center, and one of the leading foremost experts on carpal tunnel syndrome here in the area. And wanted to talk to you about that today. Just exactly what is that? Because people joke, type too much on a laptop or something like that, you might get carpal tunnel syndrome. But it is a serious concern, and if you would, just describe some of the symptoms of what carpal tunnel syndrome is and what can cause it.
Absolutely. So most people will have numbness and tingling as their primary complaint. What that feels like is when you sit down for too long and your leg falls asleep, but you get that in your fingers. So that is what most people get. A lot of people will wake up when they're sleeping with it, and it'll actually wake them up from sleep. So if you have anything like that, chances are you have something going on that you should have somebody take a look at. Now, outside of that, you can also just get generalized achiness and cramping in your hand as well. So if something doesn't feel right, or if you're not happy with how you function on a daily basis, then probably something's going on that somebody such as myself can help you with.
Yeah, that sounds like kind of a wake-up call. If you have that tingling sensation in your fingers, and if you even wake up from something like that, that's not a good sign. So what are some of the treatments out there for carpal tunnel syndrome then?
So for most people, we can get away with conservative treatments. We can try bracing at night, or even some occupational therapy where they show you some stretches and exercises to do. If that doesn't work, there are steroid injections we can do to take away some of the inflammation around the nerve to make people feel better. And if that still doesn't work, then ultimately we can offer surgery to take care of it once and for all.
Well, if there's even something you can do to sort of prevent it from even creeping in or setting in on a serious level, are there wrist exercises or anything that can be done to prevent it from getting worse? Anything like that?
Absolutely. For people with mild symptoms, we are very happy to do conservative treatments. So our occupational therapists are great at setting people up with tendon and nerve gliding exercises. So if you think about it, if you lean on your elbow too long and you start hurting on the elbow, what do? You move your arm around, so you're putting the pressure somewhere else. That's kind of what the stretches and the nerve gliding exercises do. And our therapists are great at helping people with that if they are early on in the process. If that doesn't work, we can always try bracing to keep your wrist straight to relieve some of the pressure. But ultimately, from a day-to-day basis, people can pursue things like proper wrist placement for their typing. Just good posture is very important.
Well, sometimes surgery is an absolute must. I've known people who've had that surgery. What's that recovery time like, or can this even come back after the fact as well?
So from a surgery standpoint, if you reach that, most people can recover somewhere between 1 and 3 weeks between doing normal things again. At around 3 weeks, there's not many people who can't go back to regular activities with a very minimal discomfort. Around the 6-week mark, most people don't even remember if they had the surgery and they just feel better. There are a very, very small subset of people where carpal tunnel can come back, but that is exceptionally rare. And if that happens, there are still things that we can do to help people take care of that as well.
Well, all good information to know, and we can't thank you enough. Dr. Tom Jiao from Crystal Clinic Orthopedic Center talking about carpal tunnel syndrome. For appointments or more information, call 330-668-4040 or visit crystalclinic.com, where you can now schedule an appointment online 24/7. Again, Dr. Tom Jiao from Crystal Clinic Orthopedic Center, thank you for your time today.
Yeah, thank you so much for having me on. I appreciate you.